if you can see the chat box there. Let us know whereabouts in England you're from, or the UK. Could be from, you know, somewhere else. And you know, your dental nurse or your dentist. Do let us know who you are. Oh. That'll be wonderful. I'm still letting people in, so there's lots of keen learners tonight.
Yeah, we'll just wait a couple of minutes as people are joining. Some people that don't have the app will have to install it. So we'll just wait a couple of more minutes, but thank you to all the early birds. Some were very keen and we're here at 7:30 this evening. So thank you so much for your patience and for waiting for us. I just need to make my screen bigger so I can see everyone that's joining in. But Pretty, I can see your face there. Nice to see you. I hope you're okay. And thank you for joining, everybody.
Sorry, but yes, here. So this is your place from what I can see. Yeah. That's okay.
I'm still letting people in, so we'll start any moment. Maybe give it another minute.
We'll just introduce the chat box to you. For those that haven't used Zoom before, you know, you may or you may not have, but there's a really cool chat box function in that if there's anything you like, you can give us a thumbs up, and if you have any questions, you can put your hands up. So just to test it, can everyone give me a thumbs up? So you have to go to your chat box. Angelica's on it, Macy, Pretty, Hilary, Stacey's iPhone. Thanks everyone who's got some thumbs up coming through just now. I'm just reading all your messages. Everyone can hear okay? Good stuff, thank you.
I think we could probably get started, Emma. It looks good to me.
I think so too. So to start, we would just like to say a massive thank you to Marima and from the Dental Nurse Network. Marima, I'll let you introduce yourself properly.
Hi everyone, I'm Marima. I'm a dental nurse and the director of Dental Nurse Network, which has been running for about 10 years now. We actually had our birthday like on the 10th of April, but I didn't celebrate it, but I need to celebrate it next year. Yeah, so just a big warm welcome to you. We're like all about professional growth and development, so it's great running these webinars. So thanks, Emma.
Thank you so much. Thank you. So for those of you that haven't seen my face before or don't know much about us, so I am a dental nurse and I was managing a practice for a little while, did a bit of treatment coordinating, did some dental radiography, and then in February 2018 I decided that I wanted to launch my own dental recruitment agency with the essence of building like a really strong supported community and helping people progress in their careers. So that's some things that we focus on. We offer career advice and support, CV support, interview techniques, confidence coaching, and a little bit of training as well. We've recently connected with the Dental Nurse Network, and we're really happy to be collaborating and providing some webinars for you. Tonight the topic is autism awareness. Did anyone know that April is the month for autism awareness? Give us a thumbs up in the comments box. Is anyone aware? A few thumbs up are coming in. Okay, great stuff. So World Autism Awareness Day was actually the 2nd of April, and I couldn't let the month go by without us presenting our autism awareness presentation. So we normally deliver this over lunch and learn. Obviously we can't do that just now, so I'd like to share it with you this way. And thank you all so much for joining. I'm going to stop talking and I'm going to present my screen for you just to check. Can everyone see the slide that I have open? Yeah, getting a couple of nods. A couple of thumbs up. Perfect. In that case, we are good to go. So I need to say a special thank you to a lovely lady called Charlotte Allen. She's a special educational needs teacher, and she also advised us towards this presentation and helped us with some key information. So big thank you to you, Charlotte. Let's get started. Okay, autism, so always unique, totally intelligent, and sometimes mysterious. If you have any experiences that you'd like to share with us, please feel free to share those in the comments box, because it might be that we can discuss those a little bit later on. So our aims and objectives. So our aim is to raise awareness and understanding around the autism spectrum disorder, with the objective to understand the behaviours, characteristics, social interactions, challenges, sensory sensitivities, and communication challenges that someone with ASD faces. Does anyone know what ASD stands for? The reason why that's important is because you might not have, if someone suggests they're autistic on their medical history form, they might not put it down as autism. They may refer to it as ASD, which stands for the Autistic Spectrum Disorder. It's a huge spectrum, so you know it covers many different things. So again, aims and objectives continued is to know and to understand how the sensory sensitivities affect people with ASD, Autistic Spectrum Disorder, to be clear about communication, what we can do as dental professionals to help our patients with ASD. And then we've got some further resources for you as well. We've got some downloads that we'll share with you. So we'll put those in the comments box a little bit later on. Nicole has guessed autism spectrum disorder, and she's absolutely right. So well done, Nicole. 10 points to you. Okay, so what is autism? Now it's so vast, but in a few words to summarize, autism is a lifelong developmental disability that affects how a person communicates with and relates to other people and how they experience the world around them. Due to autism being a spectrum disorder, each person shares certain difficulties and levels of severity, sensitivities, etc., means that different levels of support are required on an individual basis. Well, we all treat our patients as individuals anyway, so we're already on the right path there. So we're going to be talking about senses in autism. Now, when I really looked into this, I was really surprised, because I always thought there were 5 senses. If everyone else thought there were just 5 senses, give me a thumbs up. So senses and autism. So our central nervous system, the brain, processes all the sensory information that we receive. The brain then organizes, prioritizes, and understands this information that's in front of us. But then we then respond with those, with our thoughts, with our feelings, behavior, emotion, or combination of all those things. So let's have a look. Sensory integration difficulties. So it can also be referred to as a sensory processing disorder, SPD for short, or sensory integration dysfunction. Has anyone heard of these? Let me know. People with ASD who struggle to deal with the sensory information are likely to become stressed, anxious, and in some cases feel physical pain. Now, hopefully this presentation goes far beyond autism and ASD, because how many of you feel that sometimes we have difficult patients or may refer to someone as a difficult patient? Put your hands up. I think at some point we've all done it, but actually I'd really like you to change your mindset with one word. If we replace a difficult patient with a sensitive patient, our understanding of their needs changes, and actually I think our level of care and the attention that we provide as well has a more positive impact. So it's all positive wording that I'd like you to consider. So there are two types of sensory sensitivity. We've got hypersensitive and we have hyposensitive. So hypersensitivity, so the brain receives too much information through their senses, therefore their brain is overloaded, and our patients with ASD can feel completely overwhelmed with the dental setting, with any setting, right? So examples could be that they find noises frightening, particular about certain colours, certain shapes, obsession with numbers, does not like the taste or smell of certain things. So with that, there's obviously a lot going on in a dental setting. It's bright. There's a funny dentist smell that we're probably all accustomed to now. We don't even smell it anymore. But for patients, this is a sensitivity that we need to be aware of. Also, the people coming in and out of the room, so another thing that we need to be mindful of, and the equipment that we have out on display as well can be frightening to someone with those sensitivities. And then let's look at hyposensitivity. So with hyposensitivity, the senses send too little information, so the brain struggles to understand. So with this, the view of the world can be more muted. So examples of hyposensitivity is not being able to hear certain sounds, not feeling pain the same way as others may feel pain, which of course, if we have patients with infections or toothache, if they can't feel it, and if they have their own struggles with how to communicate that with us, it can be really difficult. So something to be really mindful of, and being fearless as well. Okay, so a little test for you. So with the two types of sensory sensitivity, and they're being hyper and hypo. So if a child refuses to allow the dental nurse near them due to the smell of his or her perfume or aftershave, leading to the child showing aggressive behaviour, what do you guys think? Comment in the comment box for me. Do you think they would be hyper or hypo sensitive? A few hypers coming in, hyper, hyper. Oh, I sound like an MC. What else have we got? Anyone else? All the answers are coming in. We've got some winners. 10 points to you all. Hyper. It's a great MC name, isn't it? I think maybe it is already, and that's why I said that. I don't know. Perfect. You are all superstars. Great stuff. Yes, the answer is hypersensitive. Okay, another example. So a child goes out into the snow wearing only jeans and a t-shirt, claiming that they're not cold. What about this example, guys? Do you think they'll be hyper or hyposensitive? Hypos are coming through. Pretty saying definitely hypo. Does anyone think it would be hypersensitive? No, all hypos? So no from Dara. Okay, great stuff. Okay, last example, and then I'll leave you alone. So hyper or hyposensitive. So someone with ASD plays their own music at home extremely loud. However, they become agitated when they go into a shop which is playing loud music. What do we think? Hyper or hypo? Hyper. Oh, Daria's thinking about it. Sarah thinks hyper or a bit of both, she's asking. Well, guys, I'm sure you guys have been on plenty of courses, plenty of webinars to know that there's always a trick question. So this particular example is both. They're both hyper and hyposensitive to those sort of background noises. And actually, I really do hope that this opens everyone's understanding outside of the dental setting as well, because we might be out, we might be in, might be food shopping, and we can see that someone's really struggling with the amount of information that they're trying to take on. Just something to think about. Okay, great interaction on the chat box, guys. It's really lovely to see your comments, so keep them coming. Another thing that I'd like to add, so I've deliberately included a slightly older gentleman in this slide. Now, a lot of children these days are diagnosed with ASD quite early on from school, but you have to consider the older generation that didn't receive that diagnosis because there wasn't as much information back then. So, you know, these patients that perhaps, again, we may refer to as difficult, it might be that they are actually really sensitive and they haven't had the diagnosis. They don't know themselves. It might be that they have a slight Asperger's. So please be mindful of that as well. It could be our colleagues, it could be family members, it could be anyone. Okay, so how many senses do we have? I jumped the gun a little bit, didn't I? Because I've already told you there's more than 5. But these are the 5 senses that everyone's familiar with. So we have sight, which is obviously visual. We have sound, auditory. We have our touch, taste, and the smell. Can anyone think of any more senses? Nicole's saying that she didn't know that touch was a sensation and feeling things. We've got one answer from Emily. Well done, Emily. Anyone else? Fear not, because I have it on my next slide. So we have balance, vestibular. Well done, Emily. Clap, clap for Emily. And body awareness, which is a word that I find really difficult to say, but it's proprioception. I've been practicing all day to get that right. Proprioception, and that's body awareness. So with that, it might be that some people are like too close to you and they you know, so that's one example. So let's look at each of them in a little bit more detail. So sight, visual. So pareidolia is where your brain fills in the gaps. So this bunch of shapes at the top, to anyone else, that's a face, right? But with people with autism, they may not be able to interpret the shapes and the formation and composition of the shapes the same way that we see them. So instead of seeing like a very abstract smiley face, they'll just see it as a bunch of shapes. This also extends to body language and gestures, which is why communication is such a key point to discuss, as people with autism may misinterpret or not understand any prompts or gestures. In addition to this, autistic people may have a hyper or hyposensitivity to light. We've already discussed that. Dental practices are naturally quite light, and also with the headlight from the chair as well, that can be quite overwhelming for them. So it's really important to explain everything you're doing the best you can, as for some of the senses and for sensitivity to sight, especially, that bright light can cause physical pain. So that's one example for that. Okay, then we have sound. So we've got the best visual representation of what it could be like for people with autism that have auditory processing difficulties, and that would be hyper and hypersensitivity to noises and sounds. So I hope this works. Please forgive me if it doesn't. Let's have a look. Can everyone hear okay? Perfect, thank you. Okay, everyone, what do we think of that video? Do you think that was useful? I think it's really interesting how the shapes in the wallpaper and the shapes from the sofa and the colours were really bouncing out. I think that's such a clever video that they've put together there. So I hope you enjoyed it. Okay, touch, so feeling, sensation. So issues with touch are quite prevalent amongst people with autism. Hypersensitivity can cause the patient to become quite agitated and in some cases cause physical pain. Hyposensitivity can include patients not feeling any pain at all. So with that, combined with the lack of fear, obviously our patients with with ASD can actually make themselves quite vulnerable. Also with hypersensitivity, as well as dental nurses, we could be, we want to look after our patients in the chair. We might put our hands on their shoulders to make sure that they're okay, to offer some reassurance, and that's such a natural thing for us to do. But with someone with autism, just try and judge your approach by communicating it and using your words as much as you can, so they expect it and then can maybe share with you if it's accepted or not. Taste. So with an additional preference to routine and familiarity, people with autism can find themselves in extreme conditions unintentionally, and it's not unrare to see patients with autism with malnutrition and anorexia, and that could be because they're so particular with the foods that they eat, the textures, tastes, smell. So they're also sensitive to taste, in the sense that hypersensitivity could mean that piping hot foods or spicy foods. Hypersensitivity can mean that they eat plain foods and inadvertently restrict themselves. So I read an interesting article about an autistic child that would only eat a certain flavour of a golden syrup porridge that had then been discontinued. So family members and like members of the community had started some sort of like campaign to try and get it back on the shelves, essentially, because it was all that their little one would eat, and they really struggled. But also with that, we have to be mindful of how that affects their oral health as well. So toothpaste could be really spicy. They might not like the foaming of the toothpaste. They might not like the sensation of the toothbrushes. So if a parent or carer or guardian comes in for some advice with that, then there's a few options that we can try and try out. So different firmness of toothbrushes, maybe extra soft, foamless toothpaste, fruity toothpaste, the ones that don't contain mint. I'm not sure if they still do it, but GC had their tooth mousse. Does anyone remember the tooth mousse that they had? So they still do it. Okay, so with that, it's almost like, I don't know if anyone's tried it, it's almost like a yogurty consistency, and their flavours are vanilla, melon, strawberry and tutti frutti. Right, Pretty as well is nodding and saying that it's quite a milky consistency, and actually because of that, it's so high in fluoride as well. So if parents or carers are struggling with brushing their teeth and getting on with an oral hygiene regime, then it might be that tooth mousse could be recommended. So fingers crossed, there's a few different alternatives that we can opt for. Mouthwash, you have to be careful with, because obviously you need to think about the risk of the mouthwash being swallowed. So that's probably one that I would avoid. I'd probably go for the tooth mousse instead. Okay, so go across. Okay, so Have a look in the comments box, guys, because Hilary recommends xylitol gel from South Africa called X Gel. Has anyone heard of that? And Pretty as well has also shared that it's not so great with people with a lactose intolerance. So I mean, it all comes down to really understanding your patient's need, their medical history, and some bouncing some ideas off each other. So then we have smell, which is olfactory. So those with hypersensitivity have no sense of smell. They may even lick things to get a better sense of what things are. I've had that in a clinical setting where we had a patient that wanted to lick the chair, wanted to lick the spittoon, didn't like being touched. So you know, it can be quite a challenge to manage, but you just have to sort of be one step ahead. And I think when you plan with your day list and you anticipate your patients that are coming in, you might like to make certain provisions to make sure that everything's like clear as possible and as safe as possible, right? And then with hypersensitivity, smells can become overpowering or distressful. They may not like distinct perfumes or shampoos, and again, minty toothpaste may be too spicy for them. And balance, which is one of the 6 senses, so also known as vestibular. So hyposensitive, needing to rock, needing to swing or spin or get some sensory output. And then we have hypersensitive, which could be difficulties with sport, unable to stop quickly, car sickness, and difficulties with activities when the head isn't upright or the feet aren't on the ground. So like real lack of balance there. Okay, so body awareness, proprioception, there's that word again. So hypersensitive, so may stand too close to others, fails to avoid obstructive or navigate a room. So again, this is something to be mindful of when there's instruments and instrument trays on the side, and may bump into people. A hypersensitive would be difficulties with fine motor skills. It may be like a dexterity challenge for them to brush their teeth effectively. So maybe advising adaptable toothbrushes, sorry, and the like. And it may be that they move the whole body to look at something and to get into a comfortable position. So Lisa's asked a question there, if it's dangerous for her child to swallow the toothpaste instead of spitting it out. Hilary, thank you so much for answering. Okay, so let's look at the communication challenges and what some difficulties may be or with communicating with patients with autism. And if anyone can think of any and wants to share them in the box, please do so. So when considering our way of communicating, please be mindful that people with autism may not have any sense of irony or sarcasm, and it might be that they don't understand metaphors. So it might be like a really innocent, playful joke or tongue-in-cheek, but actually someone with autism may take that quite literally. So their thoughts are very black and white, and they take things literally. So keep that in mind as well. Try and keep communication as clear and concise as possible. So let's look at some initial strategies. So Nicole, thank you for sharing. So Nicole said that they might not be comfortable with eye contact. And again, it is on a very individual basis, isn't it? It could be mild, it could be severe autism. So this is on an individual basis, but the point is just to help you think about a few different ways of communicating. So initial strategies. So we could ask on the medical questionnaire. I hope it should be on their questionnaires, but if it isn't at your practice, then it would be nice to include it. So on the medical questionnaire, to ask if the patient has autism or if they're waiting for a diagnosis. Prior to the appointment, to have a telephone conversation with the patient, parent or carer about what their sensitivities are, so then we can understand what their requirements are. So I have an example to share with you where we had, when I was working on the paediatric department at King's as a trainee dental nurse, we had a young boy came on, and I think it was like my first or second day on department, and I'll never forget it because it was a really special moment to share with the patient, the dentist, and the patient's dad as well, that went along to the appointment with him. So this little boy had his action figures, and he was from London, but he spoke in an American accent, and he was avoiding eye contact with us. Whatever we were trying to encourage him to do, to sit on the chair, he, it was going straight past him. He really wasn't taking any notice of us at all. He was so engrossed into his action figures. So I got the suction tubes and I took them off, and I called the wide bore like a super sucker, and then the salivary ejector bendy wendy or something silly like that, and I mimicked his American accent, and that was the way that we communicated with him and encouraged him to get onto the chair. And honestly, it went so well. The dad was so impressed and so happy that we even were able to break down his barriers and to get onto that level with him. Another example that I can give you is while I was a practice manager, we had it on a medical history form as ASD. And the patient hadn't come in yet, the mum was just bringing off the form, and then I noticed it and had the conversation with her about what he's sensitive to. And the mum was so appreciative that we took the time to understand that, because she had put off taking him to the dentist because she wasn't sure how he would behave. And in understanding that, in making extra time for the appointment, in booking the appointment at a time where it was quieter, so less overwhelming for him with people in the waiting room, all those little things that we did to care for that patient meant so much to the mum, and it made the appointment for the patient far more comfortable as well. So really nice experiences in delivering patient care. So yeah, prior to the appointment, have a telephone conversation and feel confident and comfortable to do that, because anyone would really appreciate that you're taking those steps to understand their needs. You could arrange a couple of preliminary visits to get them used to the environment and team. So it might be that first time around you don't even go into the surgery, but they meet one person, one dental nurse, so they have that familiar face that they then recognise the second time round. So to be mindful that cancelling and rescheduling an appointment can be very distressing in some circumstances. So we had a patient once, and this made me feel really uncomfortable. We had a patient once, and 3 hours before the appointment, I was asked to cancel the appointment. And I didn't want to do it because, this is a patient that had a long-standing treatment, and I just knew that they'd be really distressed. But I had no choice. I had to call and cancel the appointment. This patient was, of course, distraught, and I was so upset because I knew they would be. And if I had a little bit more power to ensure that the patient was seen that day to avoid that, then I would have done it. But unfortunately, it was out of my hands. And it's something that's really stuck with me. So I hope in sharing this example, you guys can share it with your team, share it with reception. So you try and stick to as much routine and the plan as much as possible to avoid any upset or any upset. So if your patient is accompanied to the appointment, then the parent, carer, friend may be able to assist you with ways in which you can communicate. And also they may be able to help you with calming techniques if challenging behaviour does arise. So I think we all have to be flexible with allowing the treatment to be spread out over multiple appointments, so as to cause minimal distress to the patient. And obviously, you know, there is a specialist referrals that you can refer on to, but you know, that's down to the discretion of the practice and patient and the clinician that's treating them. You know, our main priority is to ensure that our patients are safe and well cared for, and they're receiving the best treatment that, you know, we can provide. So if we feel that it's unsafe in the practice that we have, then it might be that a referral was the best option for them. And then we're coming to the end now. So the British Society of Paediatric Dentistry have a download that you can access. I think we have access to it, so we can share that across with you. And also for any more information and downloads, autism.org.uk have loads of resources. If your practice wanted to do some fundraising for next Autism Awareness next April, then there's loads of information amongst other similar sites that offer some guidance and support with that as well. So I hope that has been useful. I've tried to condense it down because I know it's Wednesday evening, and I really appreciate your time this evening. So thank you all so much for joining. And then I think now we should do a little Q&A and go from there. I'm going to catch up on all your comments, but thank you so much. If you have any questions, please feel free to ask. If you would like any resources sent to you via email, if you private message us your email address, then we can share that with you. Thank you so much, everyone.
Thanks, Emma. Thank you so much for that. It's really interesting and so important to know, isn't it? You know, like I didn't have any learning when I was dental nursing. I didn't know these things. So I guess you learn on the job, but it's really good to have that information as well.
Absolutely.
It'll be good. I think it'd be good to get the slides. People might want to see the slides again as well. We have recorded it as well, but
yeah, we've recorded it, that's right. So we'll try and upload it onto YouTube, and then it'll be on our blog channel as well. But you know, if you have any friends that you think would like to see this, we can always hold another webinar. So a couple of you have mentioned that you're coming along to our coffee morning on Friday, which will be amazing. So for those of you that don't know, so another way that myself and Marima have collaborated with Practices Made Perfect is we're hosting a support group. It's every Monday evening at 8 p.m. And we discuss loads of different topics there. So if you wanted to come along to that, you're more than welcome to. And then a less formal, more modern day socialising event that we've organised is a virtual coffee club on Friday mornings at 10 o'clock. And it's so relaxed. So if your kids are, you know, making noise in the background, I've got a puppy dog that wants loads of attention, but it's quite relaxed. So you're all welcome to come along to that. Thanks,
Emma. I saw there was a question that came through. Let me just see if I can find it.
Stacey, thank you for your comments. So Stacey's just said that she has 2 nephews that are on the spectrum, and this is also helpful outside of the dental setting. So I'm really happy to hear that, Stacey. I'm glad it was helpful for you.
Pretty, you had a question, didn't you? Did you want to unmute yourself or type it in again?
Yeah, I've unmuted. Oh, hi.
Hello.
Finally hear my voice. Yeah, I wanted to ask, when it comes to mental capacity, so does it depend on how severe the disorder is? Because, you know, they've got sensory issues, but does that mean they can't make their own decisions, or they can't give consent for treatment?
So I think with that, they'll
Yeah.
have, you know, like a parent or carer that has like attorney rights, in that, you know, it might be that they have someone that can help make that decision with them and for them.
Yeah.
And I think as long as it's well documented in the notes that the treatment that's been presented to them, their understanding of the treatment that's required, their consent as well as their parent or carer's consent as well, and I think we're really covering things on all grounds. But I think the key is to just document everything in the notes as always.
Thank you.
Thank you so much. Thank you for joining us. Really lovely to put a face to the name.
Thank you.
If any of you have any examples, any experiences that you would like to share with us, please do unmute yourself, show your lovely faces, and share those with us. I'm just going to scroll up the comments box to see if there's any more comments or any more questions that you had. I'm sorry if I've missed them.
Could I just make a comment, please?
Yeah, who are we speaking with?
I'm Wendy. I've not got my video going. Should I do
hi,
that?
Wendy.
Goodness
There you
knows
are.
what I look like.
Hello.
Hi, Wendy.
Hi. Thank you ever so much for this. I'm not a clinician. I'm not a dental nurse or a dentist or anything like that. I'm a community engagement person and do a lot of work in the community with the dental school based in Plymouth.
Okay, great.
Down in Devon. And I just wanted to flag that as a community engagement team, we do lots of work with dental students and have developed a programme called Dental Ambassadors, where we go out into the community and work with adults and young people with a whole range of learning disabilities, including autism, and share key oral health messages with them. And that's been amazingly empowering for them, building confidence and self-esteem and all that kind of thing. And I just sort of wanted to say that, remember, your communities are out there to help and support you all as clinicians in very different settings to a clinical setting, but in the community. And I'd be very happy to provide more information if that's helpful. I work for a charity called Well Connected, and would be really keen to share that good practice, cited as good practice in the government guidelines, the Dental Ambassadors programme. So I just wanted to tell you all about it.
That's wonderful. Thanks, Wendy. Do put a link in the chat box if you can see how to do that, just for more information. That would be wonderful.
Okay. Lovely. I shall do that. Thank you.
Thank
you.
Thank you so much for introducing yourself and sharing that with us. That sounds great. Sounds really great.
Hi. Sorry.
Hi, Nicole.
I just want to say
hi, Nicole.
Hi, I'm Nicole. I'm actually a dental student at Peninsula. So hi, Wendy, as well. And I can see that we've got.
You was going to pop up.
Yeah. It was lovely speaking to you earlier. Yeah, we've been promoting it on our social media, so it's nice to see you. I can see some names from Peninsula here as well, and the program we have a whole module in our dental school, which I feel very lucky that we do have that, so we get an opportunity to actually meet people from different backgrounds, and then depending on which year you're in, you'll have different experiences. So for example, I've been able to have some interactions with people on the spectrum. Is that the correct way of describing it?
Yeah.
On the spectrum. Yeah. So I feel very lucky about that. But I just wanted to say hi, really, that's what I wanted to say. I did ask a question about when would you kind of realise that you need to maybe refer a patient to a specialist care practice?
So I think questions you need to ask yourself are you able to treat them without causing too much upset, or are you going to be able to complete treatment? Like, it needs to go down on your confidence in your patient and your patient management, I guess. If you feel that you might get halfway through and not be able to complete it safely, then it might be that referring them to a specialist would be the best option for them. And I think it's a really lovely department. There's some private practices as well, but it might be that sedation is a nicer option as well. So there's a few different considering factors that you'd need to think about, but I think really it comes down to an individual basis and your confidence in them and in the treatment that's required. I hope that answered your question.
Yeah, thank you.
You know, it depends on how much they can tolerate, essentially.
Okay.
So my cousin Lisa joined us this evening. So I forgot to mention at the beginning that the inspiration of me holding this presentation is because I have family members with autism, and it's something that I'm really passionate in. So I'm really happy to be able to present this to you all, and sincerely thank you all so much for joining. So Lisa, I'm not sure if you're still there, how confident you're feeling, if you wanted to show yourself, say hello, and share your question with us. I can't see her name there anymore. I think she's ducked out. But Lisa,
I think she is online.
Maybe she's just a bit
I think
shy.
she is. Is it Lisa's iPhone? Is that Lisa?
She's not. She said she's not good at public speaking. She's shy. Lisa, you'll be fine, but I'll ask it for you. So Lisa pointed out that we forgot to mention difficulty communicating with patients that are non-verbal. And again, you know, that could range. It could be any age group that ranges from. So I think at that point, they would be attending their appointment with a guardian, with a carer, with their parents, who would be able to interpret their body language and be able to offer us some guidance. But again, this is why it's so important that we develop this dialogue and this conversation with the parents to try and answer those questions that we have that we can't get from the patient directly. So at this point, you know, it's going to be a real team effort. I think communication skills are such a fundamental thing, in that we have to be clear what you know, if the patient's in pain, or ways in which that we can help them, how we can support them, and ways in which the patient is comfortable with us talking and communicating with them. Another thing that I forgot to mention, another reason why I was inspired to build this presentation, was because I'm comfortable speaking with people with various disabilities because I've been exposed to it from a very young age. My nan is blind. We've got my cousin's got Down syndrome. Another cousin's is autistic. So I've been exposed to many different people, many different ages, many different disabilities, or special needs. But then I've been in different. I've had different experiences where a clinician, a colleague, may not feel confident or have the confidence to even make eye contact due to a lack of confidence in how to communicate. So that's something that really triggered with me, because I felt like we should all feel confident, and we should all ensure that we are acknowledging our patients and not avoiding communicating due to a lack of confidence. So again, like, this is why one of the objectives was to try and help build your confidence in ways in which we can communicate, and I really hope that I've done that this evening. But thank you so much, Lisa, for sharing and for joining us this evening. Does anyone else have any questions or any experiences that they want to share?
I have one more question, if that's okay, about autism. I read that it's more common in males. Sorry if you've already gone over this, but then that might be because research on autism has largely been focused on males. So do you find that right now you're getting more female autistic patients than before?
I think statistically, autism is more common in males than it is females. I haven't heard that it's due to a lack of testing or diagnosis within females. I think that's just like a well-known statistic that we hadn't actually shared. So I'm really happy you mentioned it, because I'm sure that we'll include it in the next presentation, because it's actually a really interesting fact. So no, it's not as common for autism to be with girls, with females. Did anyone else know that? A few people are nodding. Okay, great.
Jacqueline, I don't know if you're trying to speak a moment ago. Jacqueline, did you want to say something? I just muted you just so while someone else was speaking, but if you wanted to unmute yourself, please go ahead.
Okay, I think that might be it. Guys, thank you so much. It's so lovely to see some of your faces, see some of your names pop up. So we've got, you know, a really nice variation of some of the candidates we've been helping, some of our colleagues in practices that we've been working in, some new names and faces that we haven't seen before. We hope to see you again. Thank you, Marima, so much for hosting this evening. Yeah, good night, everyone. Thank you so much.
Thanks so much. Have a good evening, everyone.
Have a good evening, everybody. Thank you.
Hopefully see you at the coffee morning.
I'd love that. Yeah, please come along. The link is in our Instagram bio, so you'll be able to dial in straight from there with ease, hopefully.
Okay, good evening, everyone. I'm going to close it now.
Thank you. Good night.
Thanks so much, Emma.